I'm Dan Freedberg.
I'm Daniela Jodorkovsky.
And I'm Ben Lebwohl.
And we're all doctors at NYP Columbia. Today we're going to show you how to get ready for a colonoscopy and what to expect on the day of the test. We'll be playing the part in this video of doctors, and we'll also play the part of the patients.
What is a colonoscopy? Why do you do it?
A colonoscopy is a video exam of the colon. A camera on the end of a long, flexible stick is inserted in the rectum, and the entire colon is examined, all 6 feet of it. Really, we're not looking for cancer so much as precancerous growths, polyps. If I find a polyp during the test, I'm going to take it out right then. The hope is that maybe I prevented a cancer before it started.
I take some medications. What about those?
There are really 2 kinds of medications we need to talk about. Diabetes medications and blood thinners. For patients who take a long-acting diabetes medication, like a long-acting insulin, like Lantus, most patients will have the dose on the night before the colonoscopy. Sulfonylureas, like the medicine glyburide, are usually held before the colonoscopy. Most other diabetes medicines are okay to take before the colonoscopy. The second kind of medicines that we really need to talk about are blood thinners. Aspirin is almost always okay, although in the past, we used to tell people to hold aspirin. Now we know aspirin doesn't really increase the risk of bleeding. But other blood thinners do, and usually you're going to need to hold them one day or maybe several days before the colonoscopy. Those are medicines like Coumadin or Xarelto. Keep in mind, though, that your doctor is going to individualize these instructions before your colonoscopy.
Got it. So what about after the test? What happens next?
After the test, you may be a little bit sleepy, but I'll come out and talk to you. On the day of the test, you'll leave the colonoscopy itself with a copy of the colonoscopy report. That'll have pictures, and it'll tell you what I saw. Usually that's 90% of the story. Anything I take out of the colon, biopsies or a polypectomy, needs to be looked at underneath the microscope by a pathologist. Those results can take 1 week, maybe 2 weeks to come back. If the results are normal, I usually send a letter in the mail. If it's something more important, I'm going to call the patient. Some doctors send letters, other doctors may email even or call the patient. But before you leave the colonoscopy suite, make sure you know the plan with your doctor so that you can follow up and get your results appropriately.
Can I go back to work afterwards?
I recommend taking the day off. You've just had a procedure that involves sedation. Take it easy. Don't make any big life decisions. Buy that car tomorrow, not today. Don't have that big relationship talk. Don't drive a car. Don't operate any heavy machinery. But the good news is, as soon as you're alert and as soon as you get home, you can eat whatever you like.
You've answered all my questions, but when do I have to do this again?
That depends on your individual personal and family history, but for most people it's either 5 or 10 years, depending on whether we found polyps or not. That's a long time between colonoscopies. That also assumes that the colonoscopy cleanout was okay. But either way, most patients can wait quite a long interval before having to worry about this again.
I heard that getting ready for a colonoscopy is awful. How should I get ready for it?
I've already sent a bowel preparation to your pharmacy. It's usually a kind of a big jug of liquid, kind of like this. The liquid actually scrubs your colon clean, so it's important to finish the whole thing.
It's not so bad.
This liquid's going to clean out your colon, so it will give you diarrhea. You're going to drink half of the liquid the night before the procedure, around 6 to 8 p.m. The second half you're going to save to the morning of the procedure. You should finish the liquid about 4 hours before your procedure. So if your colonoscopy is scheduled at noon, you should finish the prep by 8 a.m. Splitting the prep has actually been shown in many studies to be the most effective way to clean the colon.
I think I understand how to get ready for the test. What should I expect on the day of the procedure?
First, you're going to come to our endoscopy suite and do some registration. Next, the nurses are going to ask you some health questions to make sure we do the safest procedure as possible. You're going to get an IV where we give the medication, and the medication will be given in the procedure room. This is called a twilight sleep, where you're nice and sedated and comfortable. Most people don't remember it afterwards, but you're still breathing on your own.
How long does the test take?
The procedure itself can be anywhere between 20 and 60 minutes, but plan to spend half the day with us, given the paperwork beforehand and recovery afterwards. Now, this is really important. You're going to need an escort to bring you home from the procedure because you get anesthesia. We don't want you to go home on your own and something happens to you. Escort does not have to come bring you into the procedure suite, but they will have to come pick you up. If you don't have an escort, unfortunately, we're going to have to cancel the procedure, and all of that preparation you did will go to waste.
That liquid sounds bad, but there's also a specialized diet that people hate, right?
Actually, times have changed, and that's gotten a lot better. Recommendations will vary from doctor to doctor, but I allow my patients to eat solid food for breakfast, lunch, and dinner the day before their colonoscopy. The key is to have low residue foods, things like white rice, white bread, vanilla yogurt, chicken, to avoid high residue foods like seeds, nuts, corn, uncooked vegetables, etc. So to keep it simple, if your colonoscopy is on a Tuesday, then Monday morning you can have scrambled eggs for breakfast. Then for lunch you can have a big bowl of pasta with butter. And then for dinner you can have a piece of chicken or salmon as part of a sensible dinner. Then at around 6 p.m. after dinner, you can take half of the preparation. Then you'll have some diarrhea. You stay home that night. After the diarrhea, you go to sleep. The next morning, you can actually have a clear liquid breakfast, things like apple juice, or in my case, black coffee, because I love coffee, and I'd hate to deprive you of coffee. You can have that, then take the second half of the preparation. You'll have more diarrhea, and then you can come in and have the procedure.
With this big drink and specialized diet, am I going to need to pull over on the highway on my way to the colonoscopy?
That's very unlikely. While the speed at which the prep takes effect varies a lot in the beginning for that first half, in some people they're going to the bathroom within 30 minutes, others it could take more than 3 hours before things start really going. The second half, the part that you take in the morning, is much more consistent. Almost everyone finishes that diarrhea component within 1 hour of finishing the second half of the prep. Now, the diarrhea itself should look like a clear broth by the end. The most important aspect of whether you're going to have an adequate preparation is whether you finish the whole thing. So while it's important to know what it should look like, there shouldn't be any solid component, there shouldn't be any chunks. Ultimately, the most important question is, did you take the whole thing? If the answer is yes, the chance that you're going to have a good preparation is excellent.
Okay, I get it. It's not surgery. Still, are there risks?
I'm glad you asked. In general, colonoscopy is very safe. The risk of any serious complication of happening is about 1 in 1,000. There are potential side effects from anesthesia. It could interfere with one's breathing. We're not going to let that happen. We're going to have personnel monitoring the vital signs and your breathing rate and all of that during the procedure. If I take out a polyp, that could potentially lead to serious bleeding, but again, that would be quite rare. The most serious complication, perhaps, would be if I were to put a hole in the colon inadvertently. That's called a perforation, which could sometimes even require surgery. But taken all together, the risk of any complications serious enough for you to have to stay overnight in the hospital is far less than 1%. We hope this allays some of the fears you may have had about colonoscopy.
Colonoscopy saves lives. It's the most effective method of colon cancer prevention.
After the test, most people say, why did I worry so much? Why did I wait so long to do it?
See you in the endoscopy suite.
We'll be there.